an emergency training, which I know everybody sometimes, or a lot of people get a little bit nervous about. So we just wanted to run through it this morning with you guys and just kind of give you, just kind of slow it down a little bit and give you some tips and pointers about how to get it done efficiently and safely for the patient. So first off, I wanted to go over a couple of important facets of team dynamics that help everything always run a little bit more smoothly. Can anyone name one of the important components of team dynamics that's useful during an emergency situation? Communication. Yes, and what kind of communication?
Words.
Words, also known as what, direct communication?
Yes.
So using names or characteristics of a patient, hey, you in the flower hat, or, you know, Denise, can you do something for me? Whatever. Using names to ask for things that you need. Another important point of communication that we like to do is, and Terry loves this, closing the loop. So closing the loop, making sure whatever you're doing, you're making it known. I'm opening, this 3-0 Vicryl is open on the field, or I'm going to get the bone flap sealer, yada yada. So making sure you're using that communication is very important. Another important part of an emergency situation that helps it go more smoothly is, does anyone know? Role assignments. So making sure we assign roles at the beginning is super helpful. And why might that be helpful? Does anyone know?
People aren't doing the same jobs at the same time.
Exactly. If nobody knows what their role is, things can get done. Multiple people can be doing the same thing, or nothing gets done because somebody assumes someone else is doing it. So assigning roles is crucial to making sure that you are, everyone's on the same page, everyone knows what their job is, and things get done more efficiently. So at the start of an emergency situation, it's always good to assign roles, and then just remember to communicate throughout the entire procedure. Today we're utilizing 2 techs, 3 nurses. In this scenario, depending on the time of day, obviously, if it's at night, you've got 2 techs, you've got Fahime, and she'll call the on-call nurse in, so you'll have 2 and 2, and then you can always utilize PACU if needed, but it just varies on the time of day, how many people are here. But sometimes in the middle of the day, if we get an emergency training posted, it can be a lot of people that get sent into a room to help. So just know that if you walk into a room and there's a lot of people in here and you don't really have a job, you are more than welcome to say, I'm available if you need me, but excuse yourself, so that we don't always need 10 people in a room to set up. Sometimes that makes things more confusing and more chaotic. So just always remember that too. If you're asked to go in and help and you walk in and there's already a lot of people, you can always say, hey, I'm here if you need me, but I see you've got a lot of people, I'm just gonna step out. So always know that that's okay as well. So, okay, well, we'll get started. My team here is going to assign their roles, and then we'll get going. We're going to stop at certain intervals to just kind of give you some tips that we think might be important for people, things that people seem to have questions about, certain parts of the setup. So we'll pause, and then we can also answer any questions you have. Just raise your hand or speak up. Okay? All right, so ATB is assigned to this room with Denise, and she gets a call from charge nurse that there is a 9-month-old infant, unrestrained MVC, that is coming needs an emergency craning, and there we go. So,
All right. So then Dree happens to hear that there's an emergency. She comes to see if I need any assistance, and I do. I need an ancillary person. So Dree is going to go out and scrub first while we open up everything. So Dree, go ahead and get scrubbed. Open your gown and gloves and go ahead and get scrubbed.
And I have sent Terry and Lauren into the room to help ATB, so they're going to talk about their.
So I'll get the bed ready. Can you run and grab things? Can you chart, please?
Of course.
Everything's fine, just that. And I'll fill out the blood slip. And help them. I will go get the bone flap. I will get the nurse.
before we get set up. Yeah, it's gonna determine where everything is positioned in the room. And if we don't know that from the get-go, the surgeon might walk in the room and say, this is a left-sided cranie, and at that point, everything has to be moved in the opposite direction. So laterality is extremely important, and you might not get that when they call to tell you the case has been posted, because if it's Isabel or somebody who doesn't know to ask, if the surgeon forgets to tell, you may not know that. So how can the nurse figure out which laterality it's going to be without, if you can't get in touch with the surgeon, if it wasn't posted initially? Yeah, look in the H&P, ED, sometimes the ED notes have it. You can look at the imaging, that'll usually give you an indication. So in charts, the nurses can go under the imaging and look at that up and figure that out. So that's always something to make sure you know right at the beginning, okay?
It also helps the tech. You need to know if you're setting up for a right side or a left side cranie so you can arrange your table. So it's important for the whole room.
All right, and then another thing, where's the emergency cranie cart kept? Does everybody know? Outside of door to the left of that door, the emergency cranie and emergency shunt cart, that's where we keep it. All right. And then if you are not in OR4, we have everything in here, obviously, for an emergency situation. But if you're not in OR4 and they post an emergency cranie, what equipment do you need to grab to bring into the room?
The neuro travel.
Neuro travel cart, your tower here with your Bovie and your bipolar. What's another important thing you need to have right at the beginning?
Midas Rex pedal.
That's right, Midas Rex pedal. And where can you find an extra Midas Rex pedal?
Your
Hopefully.
red closet.
In the neuro closet, yes.
Very organized.
So all key things to have in the room. Okay? All right, so we will go ahead and finish getting open and getting our beds. This is going to be a right-sided, so. If you are in another room, they're in the neuro closet. Okay, and then if there happen to be none in there, 15 has some in that little back alcove as well. All right, and then let's talk about trays. Do you want to talk about those?
I'm gonna talk about this first. So once the second scrub gets scrubbed in, you're the ancillary person. She's primary. We don't all just grab at instruments, throwing them at surgeons. She's primary. She lets me know when she needs my help. I don't just jump in and do anything. So as an ancillary person, the first thing I'm gonna do is get the drill ready. So she's working on instruments, and she'll leave me a little hole somewhere that I can just dump all this stuff out here and get the drill ready. Give me a half sheet, please, ma'am. So I'm gonna work on getting the drill ready, because we wanna make sure that's working and our pedal is good to go. Before that kid hits the room.
So you always want the drill pedal to be near the head of the bed. So this is the right side, so we've already got our drill. This is how we normally keep it in this room. If this was the left sided training, we would put the drill over on the wall over there. That's where the wall nitrogen is.
We don't have to filter it.
So this,
Oh, you got it.
so at this point, I would put my drill bit on. We're always gonna start with an M. Your M is gonna make your hole. M, make your hole. So it's gonna be an M33 or an M8. So all of the dots, I don't need that. We didn't open any drill bits. Did we grab an M8 out of the cabinet, somebody? Sure, Denise.
Denise, I like the M that make your hole. I like that.
Or M33 is fine.
Just a M, any kind of M.
And let's talk about this now. For an emergency training, if you don't know what drill your surgeon prefers to use, how can you find that information?
Is it over here in the
Yeah,
package?
it's on the wall right here. It's also listed on the preference card. So right here is your surgeon, their glove size, their drill bit preferences, and then the prep that they like to use. So, if you don't know, you can refer to this. It's also listed in here for the nurses to look at. And then obviously you've got your pictures here for your setups for the techs. So always know that that's a resource for you, if you do not know.
And Kenny, you mentioned the cart over here. Where did Kenny go?
Didn't they send
Oh, there you
over
are.
the bags?
Yeah, we used to have that there, but what was
Okay.
happening was everything was expiring because nobody was using it. So we
Okay.
stopped putting it together and just put the information up in the room. It's on the preference card and it's in the rooms.
It's also, just FYI, on that cabinet door above wherever the glove size is for the residents, that also lists their information for the surgeons. So there's multiple places you can find that information in the room.
Okay, so we're gonna continue.
Let's talk about the drill just a little bit more. Though.
Absolutely.
Drill troubleshooting.
Okay, so I got my drill, I think my drill is hooked together. Let me make it not be hooked together. And hooked to the pedal, and I attempt to step on it, and it does nothing. So the first thing is, I'm gonna check up here. I'm gonna make sure my bit is really seated. If the bit is seated, then I'm gonna try again. It doesn't work again. Now I call my circulator over so she can take it out and put it back in to make sure that was done correctly. After she does that, if it doesn't work again, now we need to check the walls. We need to check here, we need to check over there just to make sure it's turned on. Once it is, and I can get this sound, and we know it's good to go. Now guys, you just don't, and you think you're ready to go. That black filter has oil in it. The oil needs to make its way all the way to the handle. That's what keeps the handle cool. If you don't check it beforehand, it could stop functioning for you during the case. So you want to step on it 30 seconds or until you hear it rise. Sometimes it'll rise up to let you know the oil is there. If it doesn't, just give it about 30. And then you know your drill is ready to go. Because we gotta have this if we don't have anything else set.
This is crucial to have ready at the start of the case. It never feels good for the case to get started and this to not work, and then you are scrambling. So always just make this a priority to make sure this is working as quickly as you can get it set up.
One of the things that I do to make the case go faster as surgical technicians, if I know the age of my patient, I'll go ahead and get out my B, whichever B I think I need. If it's 3 or older, I'm going with an adult. I'll take this and the bit forward is gonna be on my male, so I don't have to be fishing in here trying to change it. I actually don't have to take the whole cord out of the doctor's hand. I can just pull that off and put the new one on. So you wanna think ahead, be ready. Don't wait for them to ask and now you're going to get it or getting it ready at that point. Any questions about the drill?
120 is the PSI.
150
150?
is what it's usually set at. But you just want to make sure it's making that strong sound consistently. Strong drill sound. All right.
All right.
So we're going to go ahead and continue setting up. This is going to be Dr. Boyston's case. So if anyone knows Dr. Boyston, you know that he has a special prep table that needs to get ready. Another thing about Dr. Boyston is, and Dr. Brahma, they prefer her to work with music, so we're gonna just turn it on.
Miss Denise, could you put my
Ready?
drinks together and get my meds for me?
Are you good?
Yes, I am good.
All right, here we go.
Hey. Okay, lady.
All right, sir, we got a case.
Thank you, Terry.
We would have a warmer setup as well, guys, we just don't have it.
Be able to let all of my chemicals together.
Absolutely. Thank you.
Yes.
Yeah. Judy, would you like to count with me? I'm gonna count for her while you set up. All right, ready for some tests?
Miss Denise, Terry, for break.
No stress. We wouldn't have one this time. We have laps, we don't, you wanna get this other tray going here?
Yes, ma'am.
Switch sides. Count is done.
All right, we're gonna pause here. Now that we've given them a little time to set up, Dr. Boyson is in the room. He is ready to start the case. So he's gonna do his prep. We've got his prep table set up over here. I wanna throw these things on there. His prep. All right, so we're gonna get, do the timeout. So he does his timeout and then, well, actually, we guess we gotta pretend like we're draping. Put the drapes up there.
Absolutely. Speaking of drapes, so the U-drape comes in all of our packs. The U-drape comes in packs. But if we're doing cranings, for everybody except Dr. Boydson, you want to use a neurological drape. And if you open the neurological drape, you need to add another section to the field because you need to connect it to this drape. So everybody uses this except who?
Boyson.
So since we're working with Dr. Boydson, we won't have it.
And the other thing about the section for the neuro drape is if you forget this, the circulator can always open it after the fact and just unsterilely hook it up. So if you forget to open that, that's fine. We can.
Hey, you guys on that drape, does it have a cap or do you have to cut it? To open up the suction?
It does not have a cap, you can just pop it on. You just open it and pop it on.
Okay.
And then the other thing to remember with emergency cleaning for the circulators is 2,000 of fluid, your local, under 3/4% lidocaine with Epi, 3 and older, 0.5% lidocaine with Epi, gel foam, thrombin, and gel powder. Everybody likes that. The other thing, is Flow Seal for Dr. Leopard. But you have gel powder, gel foam, thrombin at the start, you're good to go. So, all right, so we'll do the draping, and we'll get started with the case. And then,
Oh, this is a good thing.
that's good, Drake.
Okay.
You wanna talk about anything else? Move
So guys, for neuro, you know, they do not like for the drape to fall on the anesthesia side. So this technician that brings it up, what are we operating on? So for the U-drape or neurological, whatever you're using, once you place it down, I keep my finger in the middle to show them where the center of the drape is. Sorry, that's okay. I'm gonna put it down, I usually let them take it. Once they take it, if they forget and just drop this, you grab it and bring it back up. So your job is to hold on to this end that you're taking down, and you wanna keep the front. If you can get your surgeon or his assistant to take that front, it's wonderful. And you bring this up to anesthesia. We're gonna drop it since we have, people trying to look. But they'll clip it there, then you get this side and hold it till they clip this side. Go ahead, bring it in. So that it's up.
Alright, so we've got our draping, Dr. Boyson does his timeout, gets started, case of proceeding, and then he tells the room, we're gonna save this bone flap. So, at that point, the circulator is going to make sure the bone flap sealer is in the room. What else do we need to have to do a bone, store the bone flap?
Culture, well, do you ask if there's culture swabs?
We don't usually culture anymore.
No, okay.
They usually do not culture. There is a packet. And in that packet has your forms and has the clear bags that need to go onto the field. Is there a
There's
practice one
yes,
down
it's
there?
sample down there.
Somewhere. Maybe in
Look
there.
underneath it.
Denise, if you guys have time to dunk the bone flap before you put it in your bag, to wipe it off, rinse it out.
I try to wipe it off, I try to get the excess blood off of it. Yeah. And since we're not culturing anymore, I usually have a bone bowl ready to go. So just dump it in the saline and just rinse it off while we're still doing the case. This is not something that has to be done right now, as soon as they take the bone flap off. You can wait till the end of the case to do it. There's no rush on the bone flap. Somebody took it.
We have a lot of knife packets. We have a lot of packets.
Alright, so as the circulator, when you hear the bone flap's gonna be stored, you need to grab this little packet, open this the clear bags to the field. You've got the form in there to fill out, so the charting can get that ready. What else do you need to have to send the bone to tissue bank? Ice. So,
I'm gonna go get the
somebody needs to go get ice, or you need to call for someone to bring you ice.
So inside of that packet are 3 bags. If you notice, 2 of them are rounded and 1 is not. This is not a bag. This is the top that goes over it before you seal it. But these are like peel packs, because when the bone comes back, we have to open it up onto the field. So if you look for those pieces, you know what the bone is gonna go in. One's bigger than the other, so let's put it in the small one first and then put the small one in the big one. The sealer is squared, the other 2 are rounded at the top. Okay, so we'll put our bones, I guess it's in the bone way too. So we'll put our bone,
Oh, yeah, I didn't see that.
give me some bone.
Here.
I'll take a ball, that ball is mine. So we'll put it in the bone, in the
You
bag.
need to move it around.
Take the square portion,
Sorry, I did it.
put over the top,
No, we plug this right now.
straighten it out as much as you can. I usually go all the way to the end.
Okay, this, pardon me. Excuse me.
And it needs to be plugged in, so just make sure it's plugged in.
There you go.
And you don't need to mess with the settings. The settings on the side should always just stay the same.
It should be on 4, that's why
Yeah.
you see it written all over. So if somebody has used it, sometimes downstairs will go, come up and get it and use it, and they'll change the settings, so just make sure it's set on 4. So I'm gonna come over here to my circulator, and I'm gonna just place it in. I'm still holding this part of it. I'm gonna place it in. She's gonna push it down. It's not gonna pop up as you plug it in. Yes, you did. Then, oh! Once I pull it out, I'm gonna hand her the cover. She's gonna take that off. Now it's still sterile. I'm gonna fold it down once or twice, depending on the size of the bone. Place it in the second rounded packet. Come over here. You wanna make sure that where you're sealing it is not on top of the second bag, okay? I'm gonna put it in again. And then I can walk away, because now that's hers. Any questions on that part?
You just push it down, it will pop up when it's done sealing. And yeah, that's key. Do not make sure that seal, that second seal does not include that first bag, because then you're gonna have a lot of trouble when you're going to open it up later after the fact, when you're putting it back on. Then after that, what do we do with it?
Label it a lot of times.
And it's important to make sure the patient label is on there, and the date, and make sure the accurate date is on there. If it's an emergency, then the date should be listed, it should already be printed on the label. But date and time.
And then I would fill out this form and put stickers on both layers. And
Lauren,
then
if you don't know how to fill that out, how can you, where can you get a
on the
resource?
side of the machine, there's
Well,
instructions.
hanging on there.
Hanging on the side.
Yeah, on the little hook there is a form already filled out that you can use as a guide.
And then you chart it in the computer as well.
Yeah, so when you take a bone flap off of a patient, it's technically considered an explant. So you're going to document explant of an autologous cranial flap in the computer. And that's all listed, I think it is on one of
Yes,
the.
I think so.
Yeah,
It is on there. It is on the record.
and it is on the preference card as well. So once it's labeled, and I put multiple labels on there just to make sure, and then you put the bone flap in a bag and put the bag inside of the ice. Because you don't want the ice to make the labels wet and cause them to rub off. So I always put the bone flap that I collected in a bag, and then put that bag in the bag of ice. And then you send it down to tissue bank, and I always call them and tell them we are sending you a bone flap. That way, if it doesn't get there, they can be questioning, why hasn't this come? All right, you have anything else to say about it?
For your trays, let's say you don't have a second person helping you set up. You don't have to organize these. Just pull out what you need. Get your knife handles up, get your scissors up, some hemostats. Just get what you need first during the case. I can still find stuff even if this isn't organized. So just remember that you don't have to organize it during an emergency crane if you don't have time to do so and you don't have a second set of hands. Just get out what you need right now.
Any questions from anybody?
Is the scrub person dancing the whole time?
You can dance as much as you want. Dr. Brahma, if you've worked with him, depending on the stress of the situation, he'll dance the whole space if you play good music.
Question, ladies, as far as suture, what suture do you always have, no matter what, for the crane? Are all of them different? Like
Well, it depends. If the dura is open, you know you're gonna need some type of Neurolon or Surgilon if it's Bill. If you don't know, then when we hit the room, I'm asking, what do you need for this? Do you need suture? What do you need? I don't open suture in the beginning because it can change. They can decide to do something different, and that's a big waste. Plus, you know, we're running out of everything, so I don't open suture right away. But if I know the dura is open, because I'm gonna ask him that first, if he says, yes, I know I need Neurolon, so we gotta close it. So I'll have that on the field, but I'm not gonna open up any Vicryl.
It's usually 20, 30, or 40 Vicryl pops.
And our cards are updated and well organized. Please read the preference cards. We change them on a regular so that you do have a resource to go to if you can't contact anyone.
And
Ask the
then
questions, guys.
Dr. Boyce, I asked him, I asked Dr. B. He did say, because I was telling him we were doing this, he saw the sign, and he was like, well, I don't think there's been anybody, you know, that I can recall recently that struggled that I thought was like completely incompetent. And I was like, so just so you know, this isn't because the surgeons are complaining or whatever. They actually think you're doing a good job for these emergency cranes. He was complimentary of our staff, for the emergency trainings he's done. So, but we know everybody kind of gets nervous about it, so we just wanted to go run through it and answer any of your questions.
Do you have a phone class overnight? Is tissue bank, do you have someone on call or do they have someone in-house?
Yeah, well, it's blood bank, tissue bank, blood bank. It'll probably roll over to the blood bank line, but somebody's always there.
Use dial thing.
You dial, yeah, it'll roll over. Yeah.
What are your questions? Come on, ask us.
Denise, excuse me. Trachea.
You need a trach, is that what you said?
Trachea, the juice.
We got 11 blade, come on.
What's the little balls? It's the ramen with.
Gel
powder.
foam
Gel
powder.
powder.
And I will say, one thing about the gel foam powder and the gel foam thrombin, if you're soaking it, when you roll up on the field, you wanna have that already on your mayo. As soon as we get to drilling, you might need to use the gel foam balls or hemostatic agent, when we roll on the field. So just go ahead and place it on the mayo.
And keep the top on the balls, because if they dry out, you can't use them, so always keep your cap on.
And you use 3 cc.
It is not 3 cc's, I don't know when that started, where it came from. The little containers of powder are never the same. They say they are, but it's not. So it's like cooking, pour a little bit, stir it, see how it feels. If you need to add more, add more. If you put too much, now we gotta open a whole nother one just to balance it out. It is not 3 cc's.
I've been taking that off the cards as I update them, because every card has 3 cc's, and she
Yeah.
told me that. So I just put mixed with ramen. It should, when I update a card, if I see that, I'll just put mixed with ramen to form small balls the size of like a pencil eraser is what it
Yeah,
said.
it should feel like silly putty. Then you know you gotta know. But it is not 3 cc's.
Can you repeat again what are the must-haves on the mayo if you have to get going, but you don't have time to organize your stuff yet?
Okay, I'm gonna make sure my drill is ready to go. I want my M attachment is already set up, make the hole M. My B attachment, depending on the age of the kid, if my child is under 3, I'm going with B5. If my child is over 3, I'm gonna go with the B1. I'm gonna have that up on my mail ready to go. So I don't have to come back over to the drill to reset it when he's trying to get in quickly. Once I get that done, what you wanna throw up here are your scissors, a couple of mosquitoes. You wanna have your pin fields up, you wanna have a curette up, you wanna have a periosteal up, you wanna have your blades ready to go. I always load my blades first because we gotta get in. Suctions. We didn't put this on the field, but you know, as my primary person is up here assisting him with the draping, I'm gonna go ahead and take the suctions and everything and go and start throwing that off. My suction, my bipolar, my bowed, I'm gonna start throwing that off while she's working with him, or he's working with him. But those are the must-haves right now to start your case.